This is Dr. Christopher Carrubba with TrueLearn back for another USMLE question breakdown. This question is going to be coming from our Step 2 and Shelf exam bank and is going to really highlight some of the good test taking skills that you can use to do well on the USMLE and Shelf exams. So jumping in like I do with any question, I always like starting with the last sentence first and taking a look at the answer choices that I've been given. So here we're focusing on most appropriate treatment for the underlying cause of the patient's symptoms. That lets me know this is going to be a two-step question. I'm going to need to figure out the diagnosis and line a treatment up with that. I can then take a look at my answer choices to try to get a feel for where that question is going to be coming from. The fact that there's an EKG there already tells me this is going to be a cardio question, most likely. And I can start working backwards with my answer choices if I'd like to get a feel for what my diagnoses could be. Colchicine might line up with pericarditis. Dobutamine could line up with treatment for heart failure. I'll let you guys pause this if you want to and think about some of the rest and how those might line up. All right, now that we're all back, let's go up here and look at the question stem. And ideally at this point, you do have some idea of where this question could be going for. So again, if you want to pause it, take 1 second and do that here. You can go through ahead and look at the question stem. And then when we come back, I'll show you the big details that we might want to key in on. All right, so let's see what we've got going on here. So in this stem, what we see is important is that we have a patient coming in following a motor vehicle collision. The patient has chest pain and difficulty breathing. When we look at the vital signs here, we see some significant tachycardia as well as some hypotension. And looking at our exam, we see that there's jugular venous distension there. And some cold extremities, as well as bruising over the chest wall. And last but not least, we do have some clear lung sounds bilaterally. One thing that's going to jump out to a lot of people right here is what we don't have, and that's a cardiac exam. And that's okay. I always refer to this as omitted information. And the way you should think of omitted information is that really it's just not there. Students tend to make mistakes when they start making assumptions about what that omitted information is. They say, well, the cardiac exam wasn't mentioned, so it must be normal. Or the cardiac exam wasn't mentioned, but this is what was probably on it. Instead, what you should really think is the fact that it's not there means that whoever wrote this question believes that they're giving me enough information to answer even without that finding. So instead of thinking about what it might or might not show, I'm really just going to focus on the details that are present, which for me here are, I have a patient with chest pain after trauma, they're hypotensive, tachycardic, they have jugular venous distension, and they have clear lung sounds bilaterally, as well as this EKG down here showing you some abnormal finding. Speaking of that EKG, I think there's lots of different ways people will be able to go with this. Some people will be able to look at this and figure out what it is. Other people might not. If you're in the situation right now where you're not sure what this EKG is showing, what I'd like you to try to do is pause the video and see if you can answer this with just the details that have been given to you. Because I would say in most situations, you're going to be able to answer questions correctly, even if you don't know what that image is showing. And we'll come back to that a little bit at the end. All right, so if you did know this, or maybe you looked it up while it was paused, what I picked up on this EKG is that I've got electrical alternon. So looking down here at lead 2, I'm really noticing that alternating amplitude of my QRS complexes. And ideally now, even without that, I think there was enough information to put together that this was cardiac tamponade. It fits with the trauma, it fits with the chest pain, it explains why there's hypotension, tachycardia, and JVD. And we know that with tamponade, we're generally going to have clear lung sounds when we listen to that. So thinking about these other answer choices, colchicine, we said, went with pericarditis. That's not really something you see as a complication of trauma anyways. And we know that with that one, you would have been focused more on pleuritic chest pain. And I would have been looking for diffuse ST segment elevation on EKG. Dobutamine therapy, that might be an answer that you want to keep for a minute. We know that's something that we use for cardiogenic shock sometimes. However, it's not going to be something that you would use to treat a mechanical disorder like tamponade. You could choose to leave it around until you find a better answer, but I think there's enough there to get rid of it. Looking at answer choices C and F, which we're able to kind of group as treating a pneumothorax, we know that that's going to be wrong because we have clear breath sounds bilaterally. So that detail is what really tells us that that's not the direction this needs to go. PCI, obviously being used to treat an MI. Again, I've never seen a step 2 shelf question where they're using MI as a complication of trauma. And again, we know that definitively here, we're not seeing, any localized ST segment elevation. Pericardiocentesis, obviously a good treatment for tamponade. And then just to, clear this out and make sure we feel good about it, TPA could line up with something that we might be using to treat obstructive shock from a pulmonary embolism. And while that certainly could give me JVD, it could give me clear lung sounds. I would not expect this to be happening so quickly after the trauma. There's not really been enough time for a big thrombosis to form. And then this would not explain the electrical alternans picture that I'm seeing. Instead, I would be expecting more of sinus tachycardia, or I could potentially get that S1 Q3 T3 pattern in that question. So there's more than enough information here, really, even if you didn't know what that EKG was showing, to realize that this was cardiac tamponade and to go in and pick that correct answer of pericardiocentesis. So if you struggled with this question, try thinking about some of the details where maybe you got hung up on it and look for ways that you could have answered it correctly or could have thought through it a little bit differently. Thank you so much for your time. Hope this helped. Be on the lookout for more of these videos breaking down more USMLE questions.